Everyone, welcome to researchmd.com. Another great presentation. We're going to teach you high-yield concept in infectious disease. These are high-yield topics taken from like MixApp, UWorld, Ambos, and those high-yield questions. But we just kind of teach you about the concept. Okay, if you know the concept, you can answer any questions you wanted to. So that's the whole purpose. Again, my name is Dr. PRAMIL. I'm a physician, program director, internal medicine residency, and transitional residency. So let's get into our topic. So, 78-year-old gentleman was in the ICU. He was intubated for the past 5 days. Now he is having respiratory status been getting worsened. His saturation is decreasing. Past medical history, he was on IV antibiotic 1 month ago for like a COPD exacerbation. Okay, so what is going on with this patient? That's what like the main question, and how do you treat that? Okay, before we jump in, let's look at his vital signs. He got fever, he got tachycardia, if he got fever, tachypnea, and his saturations are dropping to 90%. The ventilator setting using 70% of oxygen, right? So he's using increased amount of oxygen to maintain his oxygenation. He's requiring a lot of PEEP too, 12 PEEP, and his respiratory volume is around 700, respiratory rate about 18. On the lab-wise, he got leukocytosis, WBC has 23,000. And chest X-ray got like worsening infiltrate on the right lower lobe. Okay, so you got an intubated patient with a pneumonia, decreasing oxygen saturation, so hypoxic respiratory failure. So what do we have? This person, they got a ventilator. So this person got ventilator-associated pneumonia. Okay, that's the diagnosis of this patient. So before we go into, let's look at the definition. How do you define it? Ventilator associated defined as pneumonia occurring, okay, 48 hours after intubation. So the patient is completely normal. When I say completely normal, you have normal chest X-ray before, no pneumonia, go to the ICU, get intubated. 48 hours later, you take a chest X-ray and you find out you got pneumonia. So that is ventilator-associated pneumonia, okay? So microbiology, if you look at it, you got Staph aureus, Pseudomonas, and gram-negative bacilli. That's the most common organism we just have to treat, okay? So the question is going to be, how do you treat this patient? What's so different about this patient? This patient situation is a little bit different because he got something called antibiotic resistance in this patient. Okay, so you have to tailor your antibiotic to that group. There is antibiotic resistance coverage to be added to this person. Now, what are the requirements to meet that criteria? One, history of IV antibiotic in the past 90 days. Septic shock, greater than 5 days on the hospital before diagnosis, ARDS, dialysis preceding the diagnosis of ventilator-associated pneumonia. So if you meet this criteria, then the antibiotic coverage is different than the normal one, okay? Why is that? In this category, you have to cover for MRSA, which is methicillin-resistant Staph aureus, and you have to cover for resistant Pseudomonas also. Okay, so the key point is when you treat resistant Pseudomonas, you need dual antibiotic therapy. Okay, that's the key point here. So you need to cover for MRSA with the vancomycin, and then you do dual antibiotic therapy. You can use ceftazidime and ciprofloxacin. Those are the combination like currently recommended. But the thing, remember, you need like dual antibiotic therapy to cover Pseudomonas and cover for MRSA. So MRSA, we use vancomycin. Pseudomonas, we use 2 drugs, IV ceftazidime and IV ciprofloxacin. Remember, 2, dual antibiotic coverage for Pseudomonas, okay? So what is the most common wrong answer? People usually pick, the favorite combination. They say, give vancomycin Zosyn, thinking it would cover all this. But current recommendation is 2 dual antibiotic therapy. Okay, so when we go back to this test again, the question is about ventilator-associated pneumonia. You need to know the common organism. You need to know this patient have antibiotic resistant. Why is this patient have antibiotic resistant? Remember, look at this word. He was on IV antibiotic 1 month ago. What does it say? History of IV antibiotic in the last 90 days. So he meet the criteria to be antibiotic resistant coverage. Okay, so covered for MRSA, dual antibiotic therapy for Pseudomonas. Thank you so much for watching. God bless.